The CCP Living Lab is a 90 square meter area located inside the operational unit that carries out occupational therapy, neuropsychology and physiotherapy services within the neurorehabilitation department premises. The first step was to purchase, install and set up the necessary lab equipment in order to test the activities foreseen with stroke patient. A1 home-based motor activities and A4 home-based cognitive games. After having obtained the ethics committee approval, we started an accurate screening among our inpatients to identify the subjects who respected the protocol inclusion criteria. This activity involved physiatrists, neurologists, physiotherapists and neuropsychologists. When a patient was recruited, his doctor will first provide him with comprehensive information on the different study phases, underlining that its treatment were by all means an add-on with respect to an ordinary rehabilitation protocol. Then, once the patient gave his informed consent as necessary, he was considered as officially enrolled. The physiotherapist and the neuropsychologist examined each patient, evaluating his or her motor and cognitive status. Such information was collected for patient characterization and diagnostic profiling on the vCare professional portal. At this point, the clinician could access the professional portal and create a patient's record, integrating the clinical profile and assigning to the patient his or her personalized rehabilitation plan, composed by the customized motor and cognitive serious games, and corresponding to the activities to be tested in the Living Lab. For each patient, 4 sessions of 45 minutes were planned in a time range of 2 weeks. During the sessions, the patient tested vCare's motor rehabilitation functionalities through the Rehability Suite, equipped with an Astra Orbeck movement sensor and a stop box set. A bioengineer and a physiotherapist participated in each session to evaluate respectively the system functioning and the virtual coach behavior during interaction with the patient. The vCare serious games involved different body areas, which therefore became the drivers for games mechanics. Compatible gesture range from upper limb reaching movements on differing motion planes in space to combined lower limb coordination movements, dorsolateral inclination movements, load transfer, posture control, and balance improvement. Each exercise could be carried out both in upright and static position, depending on the clinician's suggestions. Once the session was finished, the patient received a report from the vCare Avatar app, showing the score for each game, accompanied by motivational feedback based on the recorded performance, and on the aims that the clinician had set for him or her. 2 additional sessions of 30 minutes each stimulate attention abilities, executive function, or both. Patients were supervised and assisted by a neuropsychologist during each session to ensure its correct development. A tablet allowed to play many different games, stimulating various aspects of attention and executive functions. In order for session to be as personalized as possible, it was possible to select games based on each patient's cognitive profile, such as exercise on selective, divided, or sustained attention, specific games for visuospatial planning, abstraction, and categorization, working memory, and different levels of calculation. At the end of each exercise, the patient received a clear and encouraging feedback about his or her performance. Once all the tests were concluded, the crucial part of the Living Lab began. On one hand, patients' feedback about their user experience was gathered through both the system usability scales and predefined interviews. On the other, we received the clinician judgment about the development status of vCare with respect to clinical needs. The big question was, had vCare met the great expectation recorded last summer? Or were they yet unsatisfied?